Bonsoir et bienvenue à ce webinaire co-commandité ou co-organisé par la Coalition canadienne de la santé et la Coalition pour les soins dentaires. It's a bit of a pioneering event tonight, bringing together oral healthcare practitioners from across the country who are in favor of the dental care program. So thank you for joining us. I'm speaking to you from Montreal, or Jojage, which is the unceded territory of the Haudenosaunee or Kanyankahaka people, also known as the Mohawks. And on behalf of the board and staff of the Canadian Health Coalition, I would like to bid you a welcome. My name's Anne Lagacé-Dowson of the Health Coalition. The Canadian Health Coalition was founded in 1979 to defend and advance public health care through programs like the Dental Care Program and hopefully eventually the Pharmacare Program, which is currently in the hopper on Parliament Hill. The coalition is made up of citizens, researchers, healthcare experts, community groups, students, and unions representing healthcare workers across Canada. This evening's presentation is our fourth webinar on oral or dental health with Dr. Brandon Doucet, founder of the Coalition for Dental Care and author of About Canada Dental Care. He's been called the Tommy Douglas of dental care. And this particular webinar is entitled Healthcare with Teeth, Part 4, an update on the Canadian Dental Care Plan. A very special thank you to my colleague, Tracy Glynn, who just drove from Halifax, where she helped organize a demonstration for Pharmacare and against privatization of healthcare in conjunction with the meeting of the premiers now underway in Halifax, the Council of the Federation. And I'd like to say a special thanks to the denturists because they have provided us with simultaneous interpretation, very, very kindly provided us with bilingual services. So if you just click on the globe at the bottom of the screen, you can select for what language you want to hear the presentation. Si vous cliquez sur le globe qui paraît en bas de l'écran, où c'est marqué interprétation, vous pouvez choisir la langue que vous écoutez lors des présentations. Et ça, c'est un service fourni par les denturologues pour lesquels on est bien reconnaissant. So the slide deck will only be shown in English, however, the deck that Health Canada is going to present, but we'll ensure that the French and English versions are available when recordings are available. And that's courtesy of Mallory Potter and Jaro of the Denturist Association. So Dr. Doucet will moderate and he will take up the mantle now. Dr. Doucet?
Thank you, Anne, for the introduction, and I would like to remind the audience members to put their questions in the Q&A section, and we will try to get to as many as possible in the second half of the event. This webinar seeks to provide an update on the highly anticipated Canadian Dental Care Plan from a representative of Health Canada, as well as hearing perspectives on working with the program from various dental providers. To give a little context, before this program in Canada, public dental spending accounted for 6% of total dental spending, which is second worst amongst developed countries in the OECD. As a result, over 1 in 3 Canadians lack dental insurance and around 1 in 4 avoid the dentist each year because of financial constraints. These are problems that have been worsening as many seniors retire and lose workplace benefits, and work is becoming increasingly precarious, leading to fewer employers providing benefits like dental insurance. In fact, a recent poll from Abacus Data shows that the percentage of Canadians saying they are delaying regular dental checkups and cleanings due to the current economic situation went from 28% in August of 2022 to 37% in April of 2024, so a 9-point increase. This same poll found that people's top 2 concerns of our dental care system are underfunding of the system by governments and increasing privatization of dental care services. For these reasons and many more, Canadians are excited about the Canadian Dental Care Plan, as it is seen as a step towards treating dental care as healthcare. So without further ado, I would like to introduce our first guest, Marika Nadeau, who is Director General of the Oral Health Branch at Health Canada, leading the outreach, engagement, and FPT relations activities to inform the successful implementation of the Canadian Dental Care Plan. Marika, I'll hand the floor over.
Thank you, Dr. Doucet. I'm really pleased to be here with all of you to discuss the impact of the Canadian Dental Care Plan is already having on Canadians and how instrumental the participation of oral health providers is to its success. As you know, the CDCP will help make the cost of oral health care more affordable for eligible Canadian residents. This is not a free dental care plan, but it will help millions of Canadians who before could not even afford to get oral health care, as Dr. Doucet just mentioned. This is about helping people, helping our community live healthier lives, and the testimonials that Dr. Lee, Jaro, and Shannon have agreed to share with you today is a true sentiment of how themselves and the CDCP are helping Canadians. To ensure a successful and smooth rollout of potentially 9 million Canadian residents, the CDCP is being rolled out in phases. Online applications are now open for seniors age 65 and above, adults with a valid federal disability tax credit certificate, and children under 18. All remaining eligible Canadian residents will be able to apply online in 2025. I'm happy to tell you that as of now, nearly 2.2 million Canadians have been approved under the plan, and close to 300,000 seniors have already received care. To qualify for the CDCP, applicants must meet the 4 eligibility criteria: not have access to dental insurance, have an adjusted family net income of less than $90,000, be a Canadian resident for tax purposes, and have filed their taxes in previous years. And to help improve oral health outcomes, the CDCP does cover a wide range of oral health care services on the recommendation of oral health providers. As you may have seen, most services covered under the plan are already available. There are some services, such as crowns or partial dentures, that will require prior approval, and that process will be available starting in November 2024. While there is no annual spending limits, as we see in private plans, there are frequency limits. However, the CDCP may consider coverage for eligible services beyond frequency limits through the pre-authorization process starting in November, meaning that there are built-in flexibilities to meet the different needs of individuals covered under the plan. By accepting to treat CDCP clients and to limit their out-of-pocket expenses, oral health providers accept to bill Sun Life directly for payment. Only the applicable copayment or additional charges or fees not covered by the CDCP will be paid by the CDCP client to their provider. That is why, before providing care, we ask that providers have discussions with their CDCP patients about the services they recommend and the portion of the services that will be covered by the plan and those that they will have to pay themselves. Given the tremendous need of oral health care services, we are making it easier for providers to treat CDCP clients, either by signing up through Sun Life, as providers have done since March 2024, or by submitting claims directly to Sun Life for payment on a claim-by-claim basis that started since July 8th. This means that eligible providers will now be able to provide care to CDCP clients, whether they want to formally sign up or choose to participate on a claim-by-claim basis. This, again, as long as they agree to bill and accept direct payment from Sun Life per the claim processing and payment terms, which is simply a billing agreement for CDCP-related claims. I want to take a moment to thank all providers who have already agreed to provide the CDCP and provide care to have agreed to participate, in the CDCP and already provided care to CDCP clients. As of July 11, 2024, there are more than 12,000 providers who have formally signed up through Sun Life, and that number continues to grow every day. I know you've been eager to get breakdowns for on a provider type, so here they are. There's already 9,576 dentists and dental specialists who have signed up, 1,693 denturists, and 794 independent dental hygienists. We also know that additional providers have started to submit claims on a claim-by-claim basis, and we hope to be able to share those numbers very soon. Submitting claims under their CDCP, you'll hear it from the others, is the same as what oral health providers are doing now with other insurance plans. Providers submit their claims through their existing electronic data interchange. They receive an explanation of benefit indicating the total amount to the provider by the CDCP. After the claim is approved, for which the majority of the claim are adjudicated instantly, providers will receive reimbursement from Sun Life within 48 hours currently, and we're aiming for 24 hours if they've selected to receive payment by electronic fund transfer. The clients will pay the provider any outstanding amount not covered by the CDCP directly if applicable. Again, in all cases, CDCP clients must not pay the full amount to the provider as they will not be reimbursed by Sun Life. This really is about enabling care for those that were not able to afford to pay for oral health care prior to the CDCP. Only EDI claims are currently processed, but both EDI and paper claims will be processed in November 2024. We have and are listening to the concerns of providers and are actively working to address them. The Government of Canada is making significant efforts to ensure that details surrounding the CDCP are clear, and more so that it is not a free dental care plan. This, either through our communication materials, including the most recent news release, media interviews, as well as scenarios on potential charges that clients may have to pay with or without copayment that are now available on canada.ca/dental. Also, Health Canada has been and will continue to work with providers and their oral health association through various channels, including already stood up and active working groups on engagement and communications, fee setting methodology, and pre-authorization and administrative processes to ensure the successful implementation of the CDCP and its evolution over time. With that, I want to thank the Canadian Health Coalition for having me here tonight, and I will turn it back to you, Dr. Doucet.
Thank you, Marika. That was very informative, and it was great to be able to see the breakdown of dental providers who are participating in the program. I know many people have been wondering that. I would like to now introduce our next guest, which is Dr. Melvin Lee, who is a general dentist who owns a practice in Ottawa, and he is part of the coalition of dental care professionals working on the CDCP advocacy. So I'd like to welcome Melvin.
Thank you very much, Dr. Doucet. It's an honor and a privilege to be speaking to all of you tonight. So I did want to just share with you my experience as a CDCP clinical provider. I've been accepting patients who have been registered on the CDCP since the first date of operation of the plan, May the 1st of this year. And I must tell you that the experience has been overwhelmingly positive for both myself and the team at my dental clinic. Administrative burdens that are talked about by the dental associations have just not happened in my clinic. I think the main reason being it's Sun Life, who is currently the claims administrator for the CDCP. And myself, I've been dealing with Sun Life for the patients in my clinic who've had private insurance through them. And I must say to you, in my experience with Sun Life, they've probably been the most seamless and efficient insurance provider that I have dealt with in my 22-year career. And that has been proven to be no different for the CDCP claims processing. Another concern that has been brought up has been the possibility of decreased or delayed remuneration. Again, not true. Since the first patients that I saw in May, I have been receiving payment through Sun Life within 48 hours of the patient being seen in my clinic. So many of these concerns and worries that were publicly stated by the dental associations across the country, just in terms of the experience in my dental clinic, is just simply not true. I must tell all of you about why I personally decided to become a CDCP provider. I actually thought back to my childhood and youth experience as really a non-infrequent dental patient. I was the son of not well-to-do Korean immigrants. And we didn't have dental insurance, nor did we have extra money for regular dental visits. And so before I entered dental school personally in 1998, I went to the dentist twice in my lifetime, once for one cavity each. And so in finding out that, as Dr. Doucet and Marika has talked about, 25% of Canadians before the start of the CDCP program could not access dentistry because of lack of money or lack of dental insurance. For me, the raison d'etre of why I have chosen to become a CDCP provider is to basically obey the calling that I took in my Hippocratic oath when I entered dentistry. And I do want to read it all to you tonight to remind all of you of this part of the oath. I will remember that I remain a member of society with special obligations to all my fellow human beings, those sound of mind and body, as well as the infirm. And so for me, really what it comes down to as a doctor and a dental care provider is a moral and ethical decision to help those that otherwise cannot access dentistry unless it is through the CDCP program. So I do want to take this opportunity to thank Marika and the team at Health Canada, and also those dental care providers who have been working behind the scenes, Dr. Doucet being one of them, to making this Canadian dental care plan a reality today in our country.
Thank you, Dr. Lee. That was a very great, it was great to hear your perspective on the program. I would like to introduce our next guest, who is Shannon Maitland, and she is a registered dental hygienist who operates Complete Oral Wellness, a mobile dental hygiene vehicle that is designed to bring dental hygiene care to patients, whether they prefer receiving care at home, at their workplace, at school, or in a residence of a long-term care facility. Shannon will develop a personalized dental hygiene care plan and deliver care in a comfortable and convenient manner. Shannon, I'd like to pass the mic over to you.
Thank you. Good evening, everyone. My name is Shannon Maitland. I'm a registered dental hygienist and a dental hygiene educator. I am the owner of Complete Oral Wellness, a mobile dental hygiene van that offers dental hygiene services to the Ottawa, Ontario area that is charted on the unceded territory of the Anishinaabe people. Thank you to the Canada Health Coalition for the opportunity to share with you some inspiring stories and client testimonials that highlight the tremendous impact of this historical Canadian dental care plan. This evening, I will ascend into why the Canadian Dental Care Plan is not just about dental coverage. It's about changing lives and ensuring oral health care is accessible to all Canadians. You'll hear from some of my valued clients who have experienced firsthand the benefit of our comprehensive dental hygiene care as a CDCP client. I have two clients who found themselves needing extensive dental care services. They were worried about how they will manage the expense on a fixed income. Thank you to the Canadian Dental Care Plan coverage, they are now able to receive treatment that they need without having to sacrifice life essentials like water, electricity, and food. Here are their stories. Start quote. The Canadian Dental Care Plan has made it easy for me to prioritize my oral health, which I know contributes to my overall well-being. It's affordable and covers everything I need, giving me peace of mind, end quote. Randy, a CDCP client. Start quote. Choosing the Canadian Dental Care Plan was a smart move for me. It's straightforward, saves us money on dental care, and helps us stay healthy. Highly recommended, end quote. Debbie, a CDCP client. As a provider, I have personally seen that oral health is systemically linked to overall health. Through assessments like blood pressure screening and oral cancer screenings, we have the opportunity to save lives. For instance, I've encountered cases with CDCP clients where these screenings may have led to critical interventions. For example, I've identified a 60-year-old man with a possible airway obstruction due to large tonsils, large tongue, a high Melvin score that was coupled with high blood pressure readings. A medical doctor referral was made promptly for further evaluation and management, potentially averting any further cardiovascular issues. On another client, a 71-year-old female, I've discovered an enlarged thyroid with a hard, fixed, non-movable nodule during an extraoral examination, requiring medical attention for a potential thyroid pathology. And then I had a heavy smoker with a suspicious 1 centimeter non-wipeable leukoplakia on a retromolar pad, highlighting the critical importance of regular oral cancer screening for early detection of potential cancerous lesions. These are the examples that underscore the vital role of comprehensive dental care. It is not only maintaining oral health, but also in identifying stomach conditions that impact overall well-being. I would also like to add, since Sun Life introduced full EDI functionality for dental hygienists, the ability to use EDI for direct billing has greatly improved my clinic's effectiveness and convenience. The submission process has been seamless, and whenever I've needed to contact customer service, they have been helpful in addressing my questions, and overall, I am satisfied with Sun Life and wanted to share my positive feedback. These testimonials are just a glimpse into the countless stories of how this Canadian dental care plan has already made a difference and will continue having a direct impact on Canadian lives. From routine dental care to complex procedures, these plans cover a wide range of essential services, ensuring that all Canadians can maintain oral health in every step of life. In closing, I want to emphasize my commitment to providing accessible and high-quality dental care to all my clients. The Canadian Dental Care Plan isn't just a service. It's a promise to our clients to provide dental health journey every step of the way. Thank you so much for the opportunity to speak about my personal experience with the CDCP since I fully enrolled into the plan as a registered provider. Thank you.
Thank you, Shannon. It was great hearing your perspective. I really enjoyed hearing how the Canadian Dental Care Plan can hopefully help people, dental providers, find potential oral cancerous lesions earlier, which is very much highlighting how dental care is healthcare and how our current system is unjust for many reasons, but one of them being oral cancerous lesions could be detected at a later stage, and that means they have higher mortality rates. So it's very much, a great point to bring up. So thank you. And I'd like to bring up our final guest here, Jaro Wojcicki. He is a third-generation denturist from Penetanguishene, Ontario, continuing a family tradition in denturism. Educated at Bates Technical College, he established his practice in 2006, becoming a key figure in the local dental community. As past president of the Denturist Association of Ontario and current president of the Denturist Association of Canada, Jaro advocates for high standards and professional development. He is known for his compassionate care and for ensuring quality dental care is accessible to all. So I'd like to pass the mic to Jaro.
Oh, thank you for that introduction. That sounded very nice. Thank you. Thank you, Shannon and Dr. Lee, for providing your insight too. It's always exciting to have multiple disciplines here and the oral health team. It's always very exciting. So good evening, everybody. As Dr. Doucet mentioned, my name is Jaro Wojcicki, and I'm very honored to be here tonight presenting in front of all of you. I am the current president of the Denturist Association of Canada, and I'm a practicing denturist in the small town of Penetanguishene, Ontario. Today, I want to share with you the impact that the CDCP has had on my patients, particularly in rural communities like mine. In Penetang Machine, many of my patients have long struggled with the harsh realities of financial barriers to dental care. Imagine wearing dentures, the same ill-fitting dentures and worn dentures for over 40 years because new ones were simply out of reach. This is something I see every day. For these individuals, a simple act of eating, speaking, and smiling without pain or embarrassment seemed like a distant dream. However, the CDCP has turned that dream into a reality, and I have the privilege of witnessing this transformation firsthand. They have shared with me that the thought of getting new dentures felt like an unattainable luxury. But then came the CDCP. When they learned that they could finally receive these new dentures without the financial burden, the relief and joy on their faces was indescribable. They could eat their favorite foods again, speak without discomfort, and smile with confidence. This is simply the power of the CDCP. The impact of the CDCP extends far beyond just the physical relief. It lifts the weight of financial stress and the stigma associated with being unable to afford dental care. Patients who once felt the crushing weight of financial burdens now walk into our practices with the hope and dignity they deserve. They no longer have to choose between their oral health care and other essential needs. They can access the care that they need without fear, and that nothing is short, and this is nothing short of life-changing. As denturists, we have embraced the CDCP with open arms across Canada. Whether we accept the CDCP fees or choose equal billing, our primary focus remains unwavering to provide much needed care to our patients. These programs has united us in our mission to enhance oral health care accessibility and delivery. It is very heartening to see the entire profession come together for a common cause that benefits so many. The CDCP is more than just a plan, it is a lifeline. It is a testament to what we can achieve when we prioritize healthcare and well-being over everything else. The program is evolving, and its growth is being shaped by the invaluable input from providers and the powerful stories of our patients. The working groups established to drive the CDCP forward are committed to ensuring it meets the needs of those it serves. We as practitioners choose to focus on these positive changes and the remarkable differences we see in our patients' lives every day. Looking ahead, it is essential that we continue to listen to our patients, adapt to their needs, and work collaboratively to refine and improve the CDCP. This plan is a beacon of hope, and its success relies on our collective efforts and dedication. Together, we can ensure that every Canadian has access to dental care that they deserve, regardless of their financial situation. Thank you for your attention and your unwavering commitment to making dental care accessible to all Canadians. Together, we are making a difference one smile at a time. Let's continue this vital work to ensure that the CDCP remains a source of hope and health for future generations. So I'd like to thank everybody on the panel also for all of your kind support. There is a lot of time that all of us put into these sort of events, and we all are practicing just like most of you on this call. So it's always fun to be with like-minded people. And I'm proud to be part of the group, being able to share stories from our daily lives. And I hope more of you have these same experiences. So thanks again for having me here.
Thank you, Jaro. It was great hearing your perspective. I really liked how you brought in unity amongst the dental profession, and it's something that I've really appreciated seeing from groups like the Denturist Association of Canada and the Canadian Dental Hygienists Association, very much championing this program, while also being able to voice their concerns and have their concerns be addressed, but also at the same time embracing the program. That's something I've really appreciated. And I want to thank all of our panelists here. It was great hearing all of your perspectives and an update on the program. And I would like to kind of shift now to the question and answer portion of the webinar. I would like to open up with a couple of questions for Marika. I believe this is more on the administrative side of the program. I'll kind of lump two questions together here because I think they kind of fit together. So one of them is, what information will be required to be submitted for additional scaling units? Most patients we have seen so far require more than 4 units per calendar year. And then another question that kind of goes in a similar respect to that is, if somebody breaks their partial denture 6 years after they get it, what type of information would need to be written to make sure that they could get a new denture, even though it's not quite at that 7-year mark?
So thank you for the question, and thank you for the panelists that presented. What I will say, so all the questions touch on the pre-authorization process that will start in November. And I've also alluded to a working group that have been put together and is actively working through the pre-authorization and administrative process. And the intent is to really streamline the process in that regard. So details currently on what documentations will be required, what providers will need to confirm related to the pre-authorization process is forthcoming. Please bear with us, but there was it was intentional for us not to provide the details now, as we wanted to work through these processes with the association that represents the dentists. I think there's a question as well about the mandate, or the government is negotiating with who. We are working with these associations that have either named providers or that are representing their members to help streamline the process on the pre-authorization. And also what I will say there on the pre-authorization is that we are wanting to make this as digital as we can, where providers will be able to submit documentation, the supporting documentation for pre-authorization electronically, which will also will also adjudicate the request for pre-authorization in an easier way than having to submit it by paper. So that is really a key thing that I can definitely share with you today, and more details will be coming closer to the fall.
Thank you, Marika. Another question that I think would be best answered by you, I believe, and it might be good for me to kind of brief the audience a little bit first. So basically the question is, we are getting different accounts on what will happen in Alberta. Is Daniel Smith, the Premier of Alberta, going to be able to officially opt out of the Canadian Dental Care Plan? I would just like to preface this by saying this would be very harmful to regular people in Alberta, because I have seen amongst her statements saying that we already have dental programs in Alberta. I would like to highlight that all of the provincial programs in that province are of much lower quality than the Canadian Dental Care Plan. They cover fewer people because of more restrictive income cutoffs. They cover fewer procedures, and the fees are lower than the Canadian Dental Care Plan. So in every way, this program is better. But I wonder, Marika, if you're able to provide some insight whether that province would be able to individually opt out.
So what I will say is the CDCP is currently being implemented simultaneously in all 13 jurisdictions. So each of the 13 province and territory, including Alberta, the CDCP is being implemented. Government of Canada will continue its discussions with the Government of Canada on dental care, but currently it's statu quo. The CDCP will be implemented, and Albertans are currently being able to benefit from the CDCP.
Okay. Another question relates to what promises the government has made to increase fees for the program over time with inflation. And they describe basically how some of the existing provincial programs have started off, more robust, but have been chipped away to the point where they say the OHIP fee guide covers about 40% of the fees that would have been paid of the provincial fee guide. So I'm wondering if you could elaborate on that.
For sure. So thank you for the question. And again, just going back and reiterating our commitment to work with the providers and this association as partners, hence why we've created a working group that is looking currently at the fee setting methodology, understanding that each profession sets their own fees and each jurisdictions within these professions sets their fees. This said, a working group has been established with each of the professions on the discussions. The CDCP fees currently have been put together using a comparable federal programs, which have increased their fees annually. And there is definitely a commitment and a written commitment that the government will reassess and increase fees based on new scientific evidence, inflation, and discussions with the providers and the associations.
Thank you. And I believe I know the answer to this one, but I think it's probably best for you, Marika, as well. We're getting a lot of questions here. It's very great to see so much engagement from the audience. So this question says, if a patient is on a provincial insurance program, for example, ADSC in Alberta, if they have a disability tax credit, are they eligible to apply for the CDCP? So this is somebody who's covered under an existing provincial program.
So great question. Currently, adults that can apply with a valid disability tax credit certificates are the ones under the federal program. So that is provided under the Canada Revenue Agency. So really the federal, if they've received it at the provincial level and they don't get it from the federal government, then they would not be able to apply at this time. But they will be starting in 2025.
Okay. Another question. They start off by talking about they've heard a lot of great experiences of people being able to access dental care from this program, but one of their issues is concerning partial dentures, and they say that full acrylic dentures are covered, but the client and the denturist prefer the metal clasp partial denture due to fit and longevity. And ask, can the denturist submit for the metal clasp partial denture and still receive reimbursement for the acrylic partial denture fee, or do they get reimbursed for basically the higher fee for the cast metal partial denture?
So what I will answer there, and maybe Jaro, you want to jump in, but the denturist should bill for the services and the procedure codes for which they provide treatment. And in that case, like whatever is covered under the CDCP fee grids will be covered. I know that denturists have and other private plans, not denturists, but in other private plans, we talk about alternative benefit clause, which would pay up to an amount of a standard procedures and they would bill the patients the difference. This is not accessible through the CDCP. So I would say providers need to bill the CDCP based on the definition of the associated procedure codes. But Jaro, just given the nuances on the different partial dentures, I don't know if you wanted to weigh in.
Yeah, I think, excuse me, I think the question was between cast partial dentures and acrylic partial dentures. As far as I understand, and maybe Mallory could even jump in, excuse me, that any partials are not covered at this point because we have to pre-authorize them. So whether it's an acrylic partial or a cast partial denture, we cannot make them at this point until November. In November, it would be at the discretion of the denturist whether you want to submit an estimate for an acrylic partial or a metal casting. So in this case, it sounds like the metal casting would make more sense. So come November, whatever the criteria may be, you would be able to submit for that procedure come November. And yes, we have from the association been really trying to remind our members to make sure that they bill for what they do and bill for when you're completed. So do your claiming when the treatment is completed and the patient is provided their product or their denture, and not to claim it before it is delivered. So I want to remind those denturists out there to please claim when your treatment is completed.
Thank
Thank
you. I would like to just speak about one of the, I'm not sure so much if it's a question, but a statement in the Q&A chat where somebody's explaining how, they hear that people like the Canadian Dental Association say things like 2 to 3 Canadians have dental insurance. So that means they have great access to care. And they go on a similar line. I would just like to highlight when organizations like that say things like 2/3 of Canadians have dental insurance, that doesn't mean 2/3 of people have access to dental care, because oftentimes with insurance, people can't afford the co-payments. Or let's say, for example, somebody with a disability may struggle to access care within the local private practice dental clinic. So I would just like to push back on that narrative, because even just the idea that, say, 86% of Canadians have visited a dentist within the past 2 years, that doesn't mean they have access to routine care. That means they visited a dentist in the past 2 years. Maybe that was for an extraction and they still have a lot of other dental work that's needed. So I would just like to kind of make sure I'm highlighting that. I did see another question here.
Actually, Brandon, can I just sneak in and just do a follow up on what you just mentioned? I'm not too sure about the other panelist providers. Numbers and statistics are one thing, but when you actually see many patients coming into your dental chair with multiple missing teeth, multiple teeth with large carious lesions, infections, rampant, uncontrolled periodontal disease, I mean, these are only the first few weeks that I've been a provider on the program. And we know that there are millions of Canadians out there that are currently suffering in this infectious, chronically infectious, bad oral health care condition. It's one thing, like I said, to think about and talk about numbers. It's quite something else to actually see such a patient in your dental chair. And I'm not too sure if Shannon and Jaro can also, affirm that this is what they've seen with many of their CDCP patients. I want all of tonight's attendees to realize there is a considerable segment of our population in this country that has not received regular dental care. And it's not a simple tooth that's giving them a problem. It is quite an incapacity for them. And like I say, many of these patients have been suffering with pain, abscess, and infection for not days, not months, but some of them even years. And so it's this, I'd like to say, this compassion that I think all oral healthcare providers must tap into and must realize why this program is so necessary to treat this previously untreated quarter of our patient population in this country.
Yeah, and I can maybe just touch on that too, Brendan, just a little bit. Doc, I totally agree with you. For me as a denturist, for me, the majority of my patients are one of two things generally. One, they have no teeth, and they have very, very worn out dentures and have not come to see anybody, let alone a provider. Nobody's looked in their mouth. Their medical doctor, dentist, hygienist, nobody for decades. So these patients are finally coming in, not only to finally get a new denture, but have somebody look in their mouth. So that's very important to highlight. And the other patient that I tend to see quite often, especially recently with the CDCP, is patients that, like Dr. Lee just said, that have rampant decay, or these teeth have not been seen by anybody again for decades and need a clearance. There's no restoring these teeth. They've been in hospitals. They're getting antibiotics. It's just a total mess. And they can finally have providers be able to provide them with a transitional upper and lower immediate denture, have some extractions completed, and really help them with their overall health. So these are by far the two majority of patients I see in my practice every day, and they would not have come see me otherwise if they didn't have the CDCP, and they didn't for decades. So the only thing that's changed in decades is now they have the CDCP to be able to come see us. So like Dr. Lee said, it's really important to highlight these things that patients now have the ability to come in and don't have that financial burden. So it's great.
Here, here.
Thank you. It's great hearing both of your perspective on this, and it is very much important to put a personal touch to this because as dental providers, I know from my personal experience, I know a lot of my colleagues have come from backgrounds where they have been able to access dental care throughout their lives, but I do think it takes a level of humility for us to put ourselves in the shoes of people who are unable to access dental care. And also look at it from a perspective of there's very small differences in our lives where we could have been one of those people who have been unable to access dental care. And we should be looking at our fellow community members who are unable to access care. And, you know, we should be looking at them. We should be outraged at their lack of access to dental care in the same way we would as if one of our family members were in that situation. The next question I would like to bring up here is something I see a few times in the chat here, is talking about the verification process and why is there a verification requirement? I think that's probably best for Marika.
Yeah, so thank you for the question. I will start by saying this is a publicly funded program, and as a government entity, we are accountable to Canadians for a publicly funded program. We have worked with Sun Life to provide as much clarity as we can to providers on the claims verification program, which we understand is a similar practice in other insurance plan, but we've made available the claims verification program process, which is a tiered approach, as well as the appeal process for providers in case that they want to appeal decision from Sun Life. Really working with Sun Life, I know that there was some concerns at the beginning about the frequency or the level of details that was required by Sun Life, and we have been actively working with Sun Life to readjust the verification program, but understanding also this is one of the biggest social programs in decades in Canada, and there's adjustments to the program. Providers and or us may not have thought things through from an operations perspective where there's potentially glitch, and the claims verification is enabling us to correct these errors either from a provider perspective or from an operations perspective. I know that Shannon, Dr. Lee, and Jaro have experienced a claim verification, and they want to sort of speak to their experience in that regard.
Yeah, if I may. This was another concern that dental associations have put out to the Canadian public and to dentists in particular. I have actually experienced one claim verification in my office. I have to say that the people at Sun Life that helped me with gathering the information and going through the claims verification process were very, very helpful, very supportive. And the actual CVR situation, I think, took less than a week to be resolved. And so again, I think that I do understand the reason why that is in place. I would hope that there are not some providers in this program that would try to take advantage, overbill, or be what's the word I'm looking for? Not be truthful in terms of their billing. And so I think that to have this type of check in place is necessary to ensure that some providers do not, for their own self-centered or greedy reasons, try to take advantage of the program. But like I say, I've actually been through the process myself. And like many of the other things about the administrative processing with the CDCP via Sun Life, it's been nothing but efficient and was quickly resolved.
Thank you. It's definitely great hearing all of your perspectives on that. A next point I want to, someone mentioned in the chat that Don Davies has been a great advocate for the CDCP and has been strongly supportive of full universal coverage for all Canadians. When do you suspect this will be a reality? I would just like to point out that, this is part 4 of the series of healthcare with teeth. The previous 3 parts have been with myself and Don Davies. He very much has championed this issue with the federal NDP, and without this minority parliament, this program wouldn't be coming to fruition. So I do just want to highlight and thank him for this. Another question, Marika, I have relating to the difference in billings for dental hygienists who work in dentist-owned private practice clinic versus independent dental hygienists. And they're wondering if that discrepancy, like where it is for that discrepancy being addressed.
So thank you for the question. And I will say that the Canadian Dental Hygienist Association has advocated for independent dental hygienists and have raised these concerns about how the fee settings are currently structured within the CDCP fee grids. And I know that there's a commitment to be looking at how we fill in that, we address that gap, and work is actively being done in that regards, and is also a part of the discussions with the fee working group with the dental hygienists.
Thank you. And I see another question here asking, what is the government doing to address the shortage of dental support staff in Canada?
So in that regards, I know that I think it's the government of Canada, but I think there's also like the provincial and territorial jurisdictions, which this falls into their purview. So working with the provinces and territories and working with the association to understand what is the gap. We do talk about shortage, but where are the shortages specifically, in what profession across Canada? So we are working actively with other parts of the government, including provinces and territories. And I know like I know one of the association in Atlantic, is trying to promote the profession in dentistry, and with the implementation of the CDCP, like it will most likely shift where how the profession goes, but we are working on trying to find solutions but need to understand the shortage, and active work is being done on that.
Absolutely. And I would just like to add as well that the shortage in, let's say, for example, the dental assisting field, in many cases can be traced back to, people not being paid enough, not giving good enough workplace conditions that they can have a sustainable career in that field. So it is something that I've been trying to push organizations to push for, is say unionizing dental workforces so that people working, can get their fair share of these $4.4 billion going towards, this new dental program. The workers who work in those clinics deserve fair wages and to be treated reasonably. And I think that would go a long way towards addressing some of those shortages, because you wouldn't see as many people leaving the field. Where did I just lost my question here? So the next question as well goes towards consideration for predetermination for extra units for dental hygiene care. And they're wondering whether or not clients who are unable to undergo probing measurements and or radiographs due to a decline in cognitive ability, such as dementia and Alzheimer's disease. So if they have difficulty with cooperation, but will they still be able to apply for extra units of scaling, is my understanding.
So in that regards, thank you for the question. it all has to do with pre-authorization, and like this is a specific example where we're working through the processes to streamline and making it as easy as possible for providers in a case where a situation would not allow the provider to take x-rays to justify based on the situation of the individual, would be things that will be considered as part of the pre-authorization. So again, we are working through providing more clarity and direction and the processes in that regards, working with the providers and their associations to enlighten the other providers on how it will work in November.
Thank you. The next question says, we know that crowns will require pre-authorization and, you know, certain criteria must be met. So this will have to wait until November, but what about bridge work?
Lisette Dufour, who's on the call.
So, oh, sorry.
Because I know there's specific questions. Do you know bridge?
No, I'm sorry, I missed. Bridge work is not eligible under the CDCP. So that's a pretty clear one.
Thank you.
So that would be listed under the CDCP dental benefit guide. There's an annex about the exclusion. So anything that is in the exclusion annex would not be would not be covered under the CDCP.
And not appealable as well. Exactly.
Thank you.
And Brandon, can I just jump in a little bit because it talks about exclusions. There's a couple of questions when it asks about precision versus standard dentures. I know that Marika touched on it a little bit. Unfortunately, standard dentures are what's covered under the program. There is no allowance for precision dentures or for implants. Those are exclusions under the plan. I will throw in the chat the link to the dental benefits guide so that you guys can understand the program from start to finish entirely, no matter what type of provider that you are. Also, to just jump back to the question that Jaro had answered earlier with regards to partial dentures, both cast and acrylic partials are covered under the CDCP based upon predetermination requirements, which will be open in November. The difference between the NIHB program and the CDCP is the administrator. So under the CDCP, it is administered by Sun Life, which has the ability to accept attachments under a predetermination. So you're able to attach it onto the CDCP and send it through, depending on when the information is released about what those attachments are. We're not sure yet. But please rest assured that all of the oral health care providers and your associations and the heads of those associations that you duly elected to represent you are involved in those discussions, are at the table at all of the working groups that have been established to guide the CDCP forward. Thank you.
Thank you. And yeah, we are coming up towards the end of our time here. I would like to just ask one last question for the all the panelists here, and then maybe go to if anyone has any sort of closing comments they want to share before we wrap up the webinar. So the last question says from one of the audience members, so there's 2.2 million vulnerable treatment needy Canadians that have currently qualified for this plan. Why have only 300,000 received care until now?
That's a good question. I would say potentially has different answers. Either we know that the wait time to get an appointment could be up to 3, 6, even 12 months in some communities. So that could be one. Looking for a provider. So we know I've talked about the number of providers that have signed up to the CDCP, more than 12,000, and additional providers that are, as of last Monday, billing on a claim-by-claim basis. So increase participation in the providers will most likely address the need. But this is like I don't have a scientific answer other than there's wait times finding a provider and getting an appointment. So as the CDCP continues to be rolled out and claims continue to be processed and providers seeing CDCP clients, that number will increase.
Thank you. Melvin?
Well, direct answer to that question, Dr. Doucet and Marika, it's because dental care providers have the choice to participate in the CDCP or not. And so I'm not too sure that dental provider or the provider who asked that question. Really, the answer to that question is if you see that there's an issue regarding the numbers that are needing the dental care and the numbers accepting the dental care, the answer is get started, get involved, start participating in the program.
Thank you, Dr. Lee. And that's very much a very important message that I think a lot of providers need to hear. This isn't some sort of abstract program. This is something where 25% of the population are going to be relying on this program very soon. And we need broad buy-in from all dental providers to make sure this program is a success. I think it's very important that we, so there's been a lot of misinformation spread about this program, but it is true that dentists can charge their normal fees. So even if there's a discrepancy between what the CDCP fees are and the dentist regular fees, which, in Nova Scotia, the Nova Scotia Dental Association said the average fees of the program are 88.6% of the provincial fee guides, which is far better than any of the provincial plans, which are usually around 50%, but it's still not 100%. And dentists are allowed to balance bill this remaining difference. As Dr. Lee has explained, the administrative burden of this program is no different than other private plans. In some ways, it's even better. So it is something that this is very much a win-win for dentists, dental providers, and patients. So I very much encourage dental providers to sign up for this program and to come into it with an open mind, because I know there's been a lot of negative information being spread about this program, but from our experiences, we've had a very, very different reality there. I wonder if any of the other panelists have anything they would like to share.
Hi. I just want to put in some closing comments, just kind of sifting through questions, answers, listening to people talk. I personally haven't had to have a verification process, so I don't have much opinion on that. We talked a lot about, the points of being low income and not having the accessibility to care. I also have faced that growing up in my life as well. And one of the main reasons why I opened up my mobile dental hygiene practice was to get that accessible access to care to that specific demographic of low socioeconomic people who do not have it, as not everybody has a wait list for it, may not accept it. So I see all those clients. I see ODSP, I see Healthy Smiles, I see NHIB, and I do it from a moral standpoint. So I really think that we all need to understand that it is for the benefit of the client. So thank you to Christina for her comment. I don't know if she's still on here. I really appreciate it. That was great affirmation, made me smile. So thank you so much. For shortage of staff, for those who don't know, I'm a dental hygiene educator. So I'm a clinical instructor at the Canadian National Institute of Health. So every year we have probably about 80, 90 dental hygienists graduating. So regarding shortage of staff, like they're coming out, the new grads are coming out. Keep in mind, COVID seems like a long time ago, 4 years ago, but for someone who worked through COVID, it wasn't a pleasant time. And I know a lot of the senior dental hygienists left the profession either due to immunocompromise. Like it wasn't a fun thing to be an essential service worker in a aerosol generating procedure. My mom passed away due to COVID pneumonia. Like it wasn't a trying time. A lot of hygienists left the profession. So that creates a shortage. Assistants go back to school to become hygienist, which I see a lot now in the school as a clinical instructor. We are seeing those assistants graduate. So I do feel that the shortage and the demand of support staff might increase over time as well. And Dr. Doucet, thank you so much, because unionization would be so cool. And that's all that I kind of wanted to add in my closing comments.
Thank you. I wonder if any of the other guests have any closing comments they would like to share.
Yeah, I can jump in quickly. I think from my perspective, I think some of the comments were, about the program and how it's running. I think for us to expect the program to have not had a few bumps along the way right from the get-go was unrealistic. So I think Health Canada, the associations, the professions, the providers, everybody really needs to rally together to improve on the program. And Health Canada has been very, very receptive to improving on the program. So I think we all need to be mindful of that over these growing pains, I still feel OHIP and going to the hospital is still not really running great, and it's been there for decades. So I think we need to give our program, the dental program, the CDCP, a little bit of a break here to get going. But as a starting point, I think it started off very well. The associations have been involved in this discussion for a year and a half now. So it hasn't just come out of the blue. The associations were very involved and continue to be very involved. So I'd like to remind those that, that the practitioners, that we as colleagues are on these associations advocating for the best interest of the program and our patients. And, one of the perspectives I have in my little town, Penetang, and I think we can all relate that we want to service and provide care to our patients in our local communities. I think when it comes to fees and it's 85%, it's 90%, it's not quite enough, all these sort of things, the way that I think maybe you could look at it, for me anyway, that all the patients that I would not have seen coming into my practice now, for me to get 90% of my regular fee is pretty awesome. I think that's great, because there's a lot of patients that don't come or wouldn't have come unless they had that. So, for me to lose $200 on my standard denture fee, I'm happy to do that. My patients are thrilled. They walk out of here with a big smile on their face. I mean, that means more to me. And that $200, we all are business people. That $200 is an advertising fee. They will go advertise my practice like no other. So that $200 is sometimes the best $200 I've ever spent. So, maybe a little different perspective, but thank you to the whole panel here. And, I hope to be involved in more of these discussions. I think it's great for all of us as dental providers and different multiple, different providers here, dentists, hygienists, assistants, dentists, all denturists, all in the same call is pretty amazing too. So cheers.
Melvin?
Yes. So I just wanted to say my closing statement, and I wanted to address two groups that are in this webinar tonight. First, to the dentists that are attending. I really need to tell you, as a colleague dentist and as now going on 3-month participant in the CDCP, I really wanted to repeat what Dr. Doucet said about this program. It is truly designed to be a win-win program. A win for, obviously, the CDCP patient who has been desperately needing dental care for years, some of them decades, but also a win for the participating dentist. In my office, I am actually receiving 100% remuneration based on the Ontario Dental Association fee guide, as I'm doing balance billing in my office. And so this claim or this concern that dentists will be needing to be receiving less treatment billing if they participate in the CDCP is totally untrue. There has been, I've seen and read some of the comments in the question and answer in the question chat, and there has actually been a lot of consultation with dentists, with dental associations, prior to this program actually starting on May the 1st. And one key element of that is the fact that this fair remuneration system, fee grid, is in place. To basically everyone else, all of the other dental care providers that are on this session. I know that your respective organizations, as I've been working with Jaro, Kelly Mansfield, the president of the Canadian Dental Assistants Association, and the Canadian Dental Hygienist Association. I know that your respective organizations are in support of the CDCP because your organization see the great need for this program in servicing the previously underserviced Canadians in our country. I would beseech you and ask each one of you to take the details and the database information from tonight's webinar back to your respective dental clinics where you work at. And maybe you can speak with the dentists in your clinic to talk about the great value of this program for the patients in this country and how this program can benefit your dental clinic. Thank you very much. I really want to thank all the panelists joining here tonight, Dr. Doucet and Anne for hosting this very important session tonight. And Marika, I'm going to give you the last word. Thank you to Health Canada for all of your work in making this truly beautiful CDCP program a reality.
Thank you, Dr. Lee. Thank you, Jaro, Shannon, Dr. Doucet, for inviting Health Canada to share information on the CDCP. But it's also like interesting to hear your perspective and stories. So thank you for accepting to do this for your colleagues. What I will say, and I've said it in my intro, we are committed. The government of Canada is committed. Minister Holland is committed. He's doing roundtables and meeting with providers and wanting to hear firsthand from providers their concern. The CDCP we've launched the CDCP. It's a new social program. It's a start, and we needed to start somewhere, and we will continue to work with the association and with providers as partners to the CDCP to make this a long-term success for Canadians and for improving oral health care in Canada. So we are committed. I am personally committed, and people that have spoken to me directly can attest to it. But we are like the claim by claim option. Try it once and see how the CDCP will work for you, and will and most likely and most importantly work for your patients. And if there's issues, we're here to listen and address them. So thank you.
Thank you, Marika, and I would like to thank all of our other panelists for joining us tonight. I would also like to thank everyone who took time out of their evenings to come listen to this webinar. I'd just like to hand the mic over to Anne just for some closing comments.
So a lot of thank yous, and I'm going to add to them. Thank you to Tracy Glynn of the Canadian Health Coalition for putting together this platform and getting everybody marshaled and focused in the same direction. So quite an ambitious webinar, and a wonderful one, I'd say. And I think also a kind of a magisterial intervention on oral care, bringing together people who aren't always seen on the same screens and collaborating in this way. It's absolutely great. So thank you to Marika, to Dr. Lee, to Dr. Doucet, to Shannon Maitland. I'd love to see the inside of your mobile unit sometime. I'm really curious now to take a look at that. And a special thanks to the denturists, to Jaro Wojcicki and Executive Director Mallory Potter for providing simultaneous interpretation. Et un grand merci à l'interprète, Madame Francine Lapointe. Big thanks to all of you. There are almost 300 people who attended this webinar, which for the Canadian Health Coalition is a record and says something about the importance of oral care, which is critical to healthcare and really needed to be included. It's so wonderful that it's finally happened. It's an indication of how important oral care is to so many people. So big love to our oral care practitioners and to Health Canada, to Marika and her colleagues at Health Canada who are making this thing happen. And we hope to see you again on a future webinar. Thank you very much to everybody. Thank you especially to Dr. Doucet, who is in many ways the instigator of all of this. And to Don Davies, who I hope is on this webinar. I'm not sure if he is or not. And Minister Holland. Grand merci à tous et à toutes. Bonne soirée.
Take care.
Thank you.
Take care. Don't forget to floss.